Module 3, the Product Application Guide. Convatec moldable technology skin barriers were designed to meet two patient needs: a barrier that is easy to customize and provides greater skin protection than traditional skin barriers. Moldable barriers feature a unique, flexible adhesive that allows users to create an opening without the need for scissors, unlike traditional skin barriers which require cutting. This video will provide step-by-step instructions on how to apply a moldable skin barrier. We hope you will find it informative and useful in managing your Convatec moldable technology ostomy system. Convatec moldable skin barriers have several components we'd like to review. First is the hydrocolloid flexible collar. The collar provides an added level of security and flexibility. Second is the plastic ring called the coupling mechanism or flange. The flange of the skin barrier is used to attach the barrier to the pouch. Finally, the circular opening in the center of the barrier is the starter hole. This is where you will begin the molding process. Now, turn the barrier over to the side that comes in contact with the skin. There is a clear cover backing over the adhesive center of the barrier with a blue tab for easy removal. You can also see a white release paper on the hydrocolloid flexible collar. Both backings should remain intact until advised to remove during the application process. These linings are in place to maintain the integrity of the adhesive. The application process can be broken into 6 steps. Preparation of the peristomal skin, preparation of the skin barrier, application of the skin barrier, application of the pouch, managing the hydrocolloid flexible collar during wear, and removal of the skin barrier. Step 1. Preparation of the peristomal skin. First, clean the peristomal skin with a mild soap and water that is free of oils and creams. Rinse the area and pat it dry thoroughly. Your hands and peristomal skin should be clean, dry, and free of any solvent or greasy substances before you begin the application process. Any oily substance will cause poor adhesion of the skin barrier. For extra protection against skin irritation, you may use a skin sealant, such as All Care Protective Barrier wipes, on the clean peristomal skin prior to applying the skin barrier. Protective barrier wipes provide a thin film that protects against skin stripping and irritation caused by the application and removal of adhesives. Step 2. Preparation of the skin barrier. Remove the skin barrier from its package, but do not remove the clear backing of the adhesive or the white release paper from the back of the hydrocolloid flexible fabric collar. One of the primary benefits of Convatec moldable skin barriers is the reduction in application steps. There is no need to measure the exact stoma size to create an accurate fit. Simply hold the barrier over the stoma using the clear backing of the adhesive as a window to view the size and shape of the stoma. Then place your thumbs at the center of the starter hole and begin to roll the adhesive back. Use the clear release liner on the back side of the barrier to support your molding action. Continue to roll the adhesive back until you create an opening of the desired stoma size and shape. The molding adhesive is forgiving. In other words, it is flexible and elastic, so the opening can be adjusted once the barrier is applied to the body. This enables you to roll back the hole beyond or larger than the size of the stoma initially, and still fit the barrier snugly against the stoma once the barrier is applied to the skin. Please note, this is a moldable product. It is recommended that you do not use scissors to cut any part of the barrier. Step 3. Application of the skin barrier. After molding the stoma opening, remove the clear backing from the skin barrier and immediately apply the barrier. Center the opening over the stoma and press the skin barrier into place. Gently push the rolled adhesive back towards the stoma until you create a nice snug fit between the skin barrier and the base of the stoma. It is important to note that the elasticity of the adhesive is such that it will rebound or begin to retract back to its pre-molded size and shape, which will aid in securing an optimal fit, but requires that you immediately apply the barrier after molding. The adhesive's rebounding memory technology eliminates gaps not addressed by the user. Once you've achieved the desired fit, press the rolled adhesive down on itself. Do this around the entire stoma to secure the fit. Then, hold the skin barrier in place for at least 30 seconds to secure it to the skin. Once the barrier is secure to the skin, remove the white release paper from the hydrocolloid flexible fabric collar and press the fabric collar against the skin, smoothing out any wrinkles. If you are caring for a flush or retracted stoma, you may need to use Convitec's convex moldable skin barriers to increase wearing time and comfort. Step 4. Application of the pouch. First, be sure you have selected the proper size pouch to fit the flange on the moldable technology skin barrier. The flange sizes must be the same. Before attaching the pouch to the skin barrier, allow a small amount of air to enter the pouch by gently separating it. Align the plastic ring on the pouch with the ring on the skin barrier at the 6 o'clock position. Using gentle pressure, continue moving your fingers around to the 12 o'clock position. You will hear a series of clicks. Give a gentle downward tug on the pouch to make sure it's locked into place. If you're using a drainable pouch, apply the Convitec tail closure by simply folding the end of the pouch over once, slide the tail closure over the fold, and snap it closed. If the pouch has an InvisiClose tail closure system, simply fold the tail end up towards you 4 times and ensure the interlocking closures overlap. Press the interlocking closures together until you feel them lock or click into place along their entire length. Wrap the security flap around to the back of the pouch, body side, and press the interlocking closures together until you feel them lock or click into place. Step 5. Managing the hydrocolloid flexible collar during wear. Flat moldable skin barriers have a flexible fabric collar that is coated with hydrocolloids to provide flexibility and gentle adhesion on sensitive peristomal skin. The edges of the collar may roll up when exposed to water. Simply pat the top side of the collar dry, smooth out any wrinkles, and press back into place. Take care to keep the collar free of any solvents, oils, or creams, as this could result in an interruption of the skin barrier to skin seal. Step 6. Removal of the skin barrier. Lift a corner of the flexible fabric collar. Wipe an adhesive remover towelette between the skin and the adhesive. Gently peel the adhesive back while continuing to wipe until the barrier fully separates from the skin. In order to prevent stripping of peristomal skin, it is important never to rip or tear the skin barrier off the skin. You're now ready to begin prepping the skin for a new barrier. We hope you found this tutorial helpful and educational. Thank you for your time. Should you have any questions, please call your local sales representative or Convitec Customer Interaction Center.